What's going on, everyone? Welcome to the Monday edition of the Pandemic Update for Monday, June 5th, 2023. Hopefully the start of everyone's week is starting off well so far. Hopefully you're staying safe, healthy. If you had to take a COVID test, I hope you've tested negative. Now today we're going to do things a little bit differently. I have decided, at least for the foreseeable future, I think it's safe to say that we should probably just add the Walgreens video. We did this last week. Add the Walgreens update within the pandemic update. The reason for that is the data from Walgreens is jumbled, and there's a lot of states that are coming up blank, and I think we can just incorporate it into this video on Mondays. But first off, we'll start with the news portion, then we'll do Walgreens, then we'll do the other normal data. So starting off here, India has logged another 174 new cases in the last 24 hours. They've also added 2 new deaths. These cases, we know, they're likely an undercount because, India has 1 billion people. I don't know what the real number is from India, but nonetheless, even if they're not the full number, they are still likely dropping. That is one thing that probably is happening. Moving on to this, State Health Rapid Response Team deployed to Chelsea Veterans Home after new COVID-19 outbreak. This, my friends, is up in the Boston metro area because it's coming out of the Boston Globe. And so I believe it's in Massachusetts. It says, as of midday Monday, 15 residents and 19 staff members had tested positive. Now, there's something within this article that, to me, is a little bit concerning. It should be for you as well. And it says here, as of midday, 15 residents and 9 staff members had tested positive. Santiago said in a statement, a state Department of Health Rapid Response Team was deployed to the home Friday to assist with staffing at the facility. Here's my problem. It says 2 of the residents had been sent to the hospital in recent days, one of whom has been able to return to the veterans home. I want to know, this leaves me with a big question. The person that returned to the veterans home, did they or were they tested again for COVID? Are they still positive? If they're still positive, that means they're potentially spreading potentially more cases in the nursing home. It could lead to more cases. I mean, CDC gives the 5 days and you're good to go. We're just going to move beyond the nursing home now. The whole 5-day rule of being negative, and this goes for anyone. It could be for you, could be for someone like me. The 5-day rule, I don't agree with it. It should be based on each individual case. You should have to remain in quarantine until you test negative. If you're not negative, you're still in quarantine. So coming back to this, in the case of this, oftentimes, maybe the person is better, but maybe they're still positive and they need to free up that bed space. That's likely what could have happened here, but again, we don't know more information. We know at the start of the pandemic that was a big issue, which led to the massive outbreaks at long-term care facilities. Moving on to this. I know we've repeated this before, we've said this many times, but if you're new to my channel and you have not seen my past videos, first off, subscribe down below because we do videos like this just about almost every day. But you need to know this. COVID-19 is a leading cause of death in children and young people in the U.S. Oh, yes. A new study led by researchers at the University of Oxford's Department of Computer Science has found that between 2021 and 2022, COVID-19 was a leading cause of death in children and young people in the United States, ranking 8th overall. That's horrible. That means COVID is still a top cause for death, and you know what? It's still a big issue. And it's something that still continues to need to be dealt with. And speaking of that, people need to start taking it more serious again. There's a problem here. Most U.S. adults are declining COVID booster as CDC warns of health risks, relatively little protection. Please, if you have not gone out and got the bivalent booster yet, maybe you feel you don't need it. You feel you'll be fine. No, that's not always necessarily the case. As time goes out further and further away from your previous shot, your protection does wane. COVID's still out there, my friends. COVID has not gone away. And it's only a matter of time until COVID pops out another variant that could be potentially more severe. That is one thing I worry about daily. I mean, we're seeing variants right now that are just, they can cause long COVID, they can cause issues, they can still cause hospitalization, but they're not as severe as Delta was. My concern is, when's the next Delta going to come? Should that happen, a lot of people are not protected and ready for that right now because they have not gone out to get the booster shot. And we definitely need more people to go out there and take a booster shot because only 20% of U.S. adults have received booster doses. That's far too low. We need that number to go up higher. And we'll include this. I wasn't going to, but I think we will. CNN has lost trust over COVID coverage, internal reports found. And yes, I can kind of agree with this. In fact, I don't watch CNN that much anymore, but I haven't heard the cable news networks mention COVID in a very long time. And you know what? We gotta, it's time. It's time for the media to start at least mentioning COVID again. All right, we have one more thing here. Let's skip that. We got to get to the Walgreens update because it is Monday. The national positivity trend for today is 23.5% national positivity at Walgreens. Prior week was 22.9%. That's a difference of 0.6%, and that is slightly up. And we have a huge testing problem going on. Who remembers when we were doing 20,000 tests? How about 30,000, 40,000, 50,000? You know, it was in the tens of thousands. This week, just only 1,758 people volunteered, I'll say the word volunteered, to go get a test at Walgreens. Why? Because, let's face it, many cases you have to pay out of pocket and it can be pricey. Not everyone's insurance is covering it now that the pandemic emergency has ended. Prior week, 2,440. And you know, when less people are getting tested, it makes the numbers look better in the sense that, oh, cases are lower. Well, that's why we do weekly videos on this channel, such as Wastewater. We did that yesterday. If you haven't seen it, it's 2 videos down below. Not the one before this, but the one before that. Let's take a look at a few states. And I am going to showcase some states that are not reporting. Like, for example, Maine, we got nothing this week. How about New Hampshire? We got nothing this week. How about Vermont? Nothing this week. We did get New York State, and New York State is relatively concerning. New York State positivity continues to rise, 36.5% this week, 28.2% last week. Difference of up 8.3%. And when we look at this chart, look at that. It started going up back in the middle of April, and it's just continued up ever since. Yes, there's been a few drops, but the baseline is continuing to be higher. Testing is down in New York State. 52 tests versus 85. Let's go over here to Ohio. Ohio positivity, 20% this week, 13.3% last week. Difference of 6.7%. That is 30 tests this week versus 45 last week. That's down. Then let's come down here to Mississippi. That's blank. I'm telling you, there's a lot of states that are blank. Louisiana, can't show you that either. I can show you Texas. 25.3% this week, 21.3% last week. Difference of up 4%. Total tests are at 316. It was 455 last week. Let's do 2 more. Florida, 29% this week, 23.8% last week. Difference of up 5.2%. 307 tests versus 353. It's not a terrible decrease in testing. So I think some of this could be testing. Some of it could be, your cases could be rising now. Let's come out here to California. We did get California. Now it's showing up red on the map. Pay no attention to that, because week over week, it's down 4.6%. 30.5% versus 35%. I know, it's confusing. 151 tests, and the prior week was 214 tests. If we zoom in here, the reason why it's red, look what's happening on the chart. It's starting to rise now. All right, moving on. We'll do a few more Walgreens states tomorrow. I just wanted to get some in there today. We'll add a few more in there for tomorrow. We're going to skip over this day in pandemic history because we don't have time for that today. Let's take a look at the wastewater here. As you can see here, and I'm going to move myself to the left so you can see, new sites 136, 0 to 19% wastewater is at 610, 20% to 39% is at 414 wastewater sites, 40 to 59% is at 129 sites, 60 to 79% is at 25 sites, and 80% to 100% is at 9 sites. Moving myself back to the right. Hello again. All right, taking a look here now, we want to take a look at B&O's weekly update. And this came out last night. 35,661 new cases. Yeah, folks, that's for an entire week. A lot of people are not getting tested, or they're using those at-home tests. This is ridiculous. So we don't, honestly, let's just say it, we don't know what the real number of cases is right now. Average is 56,450. That's down by 10,714. States reporting 32 out of 50. So a lot of states did not report, and that's part of the reason why this is down as well. 18 states did not report last week. That's ridiculous. I made a statement the other day. I think we're taking flu cases more seriously in the data than we are COVID. And COVID is more deadly than the flu. In the hospital, 10,057. That's down by 1,115. I guess that's good, but again, we're not testing on a mission. I know someone who had to go to the hospital recently, and they didn't even bother to test him for COVID. In the ICU, 1,539. That's down by 44. New deaths, 631. The average is 1,051. That's down by 346. That's actually a good thing to see. All right, taking a look at New Jersey. New Jersey added 168 hospitalizations total. 65 out of 70 hospitals reporting, 10 on ventilators, and 17 patients in the ICU. Taking a look here at Philadelphia, 744 EMS incidents yesterday. Quick live looking at what's going on locally in my metro area. Montgomery County, this is not as busy as it was earlier. It was over 20 for a good solid time frame earlier in terms of number of incidents. Chester County, we have to actually refresh this one, and not as busy as it was earlier. This morning, all the sites I monitor in Pennsylvania were really busy this morning. Taking a look at New York State, 208 new cases, 4.8% positivity. The 7-day average is 3.6%. Taking a look at New York State hospitalizations, they actually did not increase over the weekend. But we come down to New York City itself. This is New York State. And taking a look at New York City itself, there was a slight increase, and I suspect there will be one tomorrow. Come on, that's not New York City. Did our refresh again. There we go. And New York City has 202 people in the hospital, 28 people in the ICU. All right, let's take a look at some international data. And you'll see on the international data, things have not really changed too much. I don't think we get much data over the weekend, but there are a couple places I want you to see. South Korea, cases are up 28%, and weekly death change is down 11%. And then I want to come down here. Mako still has this 269% increase in cases. They only reported one death. And I also wanted to show you another place. India, down 45%. And deaths are down 41%. But then we come down here to Colombia. Colombia cases are up 62%. And deaths are up 143%. Bolivia, cases are up 110%. And the other concerning spot was Bangladesh, where cases are up 217%. They did not report any deaths in the last week. Alrighty, that's it for today's pandemic update. We'll have another pandemic update again tomorrow. And also, later this week, I don't know if it's going to be tomorrow, Wednesday, or Thursday. I haven't decided yet. We're going to finally do an East Palestine. Remember the train derailment in East Palestine, Ohio? I think it's time we do an update and see where things stand. You know, just read some of the latest news stories on that and find out what's going on there. Alrighty, that does it for today's update. I will see you all again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Until I see everyone next time. Stay safe, everyone, and thanks for watching.